Okay. So let me introduce you to Natasha Williams, whom I had the pleasure of meeting a couple of years back at a conference. And I'm so grateful that I actually got introduced to her because every day I learn a lot from her because I work with her at Integrity Management Services. So a brief overview of her excellent experience and the relevant expertise she brings to this topic today. Natasha Williams is the Chief Operating Officer at Integrity Management Services, Inc., where she oversees the business operations, program delivery, senior project management. And this helps keep the organizational operations aligned with strategic goals and targeted business growth. She's also responsible for continuous evaluation and improvement of the organization's portfolio of multi-million-dollar contracts to ensure that program delivery requirements and customer service expectations are met and exceeded. She brings more than 20 years of experience providing operational oversight, program management, and subcontractor management for federal, state, and commercial contracts. Prior to joining Integrity M, Ms. Williams served as Director of Operations, Quality Manager, and Consultant of a commercial healthcare credential verification organization. And in this role, she implemented, executed, and maintained an information management program for the fastest database system, including research, content acquisition, content management, quality assurance, content preservation, and product delivery to the client base. Ms. Williams holds a master's degree in applied philosophy from Bowling Green State University. She's been an adjunct faculty member of the Prince George's County Community College Philosophy Department for over 17 years, teaching courses in Introduction to Philosophy and Biomedical Ethics, and is also a member of the American Society for Quality. I am so thrilled to have you with us, Natasha. And a very quick introduction of myself, and I'll pass the baton to Ujjwala Kashkari, who is also a volunteer who runs the DC Emerging Technologies meetup group. So a brief introduction about myself is I'm the Chief Technology Officer of Integrity Management Services, and hence the pleasure of working with Natasha on a daily basis. I also am an ambassador for Women in AI, and Women in AI is a nonprofit that started in France and has members over 90 countries. Our goal is to increase the inclusivity and diversity of representation of women and other genders in the world of artificial intelligence. Passing on to Ujjwala, who is the Chief Evangelist of the DC Emerging Technology community. Can you introduce yourself a little bit?
Yeah, absolutely. Well, hello, everyone. Thank you so much for showing up today. I know it's the middle of the week. We're almost there, like hump day. And you know, one of the most exciting things about DC Emerging Technologies is our ability to bring together a community to discuss AI, robotics, data science, and other emerging technologies, and have a ton of relevant conversations. We usually do one event per quarter. So of course, you know, with what's happening today, this has presented us with an opportunity to bring together more events more frequently. If you are part of the community, if you're part of the meetup, you probably know we're launching another series, the Cultural AI virtual series that'll be starting on June 2nd. So I want to say welcome, Natasha. Thank you so much for being our esteemed guest today. And yeah, excited to continue the conversation, and looking forward to another successful event from DC Emerging Technologies.
Thank you, Ujjwala. And for those who came in late, I am recording this conversation. And if you do not want your any content to appear on the recording, which I can use for marketing purposes, please email me and I can edit out when the question and answer session is being conducted. So without further ado, Natasha, back to you. I know we have a lot to cover and we just have 25 more minutes left. So thank you again for your participation. I know you have a lot of good experience in the world of data analysis. And every day we are hearing in the news and social media about flattening of the curve. What are the number of cases? Either they're going up, there are a lot of visuals and graphics. So obviously everybody these days is talking about data, if not analysis. But what's important to know is data analysis is the crucial prerequisite to represent the COVID graphs that we are seeing. So with that in mind, what is the data analysis process in general? Because you have a lot of expertise in that area. And why is it important in the context of COVID-19?
Thank you, Swati, and thank you for that wonderful introduction. Very kind of you, and welcome to everyone who is a part of the webinar today. Swati is truly an inspiration, and I'd like to say if she were a hashtag, Swati would be hashtag forced to reckon with. So I did want to just acknowledge you before we jump right on into those questions. As you noted, we are getting a lot of data. We're seeing a lot of information, a lot of reports coming forth from here, there, everywhere. The media is in a frenzy. It's amazing the amount of information that's reported. We're hearing terms like fake news. Our scientists are losing credibility because of apathy as a result of this pandemic that we're experiencing. Even the most informed of citizens don't understand really what information can they trust. So when we think about data, we think about data analysis. The process really is, to begin at the level where you understand the issue or problem that's facing us, right? And then identifying the types of data sources that we need in order to really build out a picture or a framework, if you would, for what it is that should be analyzed and reported to others so that they may make informed decisions. So it begins really with the process of collecting the information. And then there's usually a question about why do I want to collect this information? In light of COVID-19, it really is a matter of being able to give information, give data that is accurate to government authorities who need to make informed decisions. It's important to give it to industry, data that will help them make decisions around things like international travel, when we can resume activities that have been common to us, education and going, to the gym, heading to a salon, just those things that really give us a comfort and well-being and allow us to engage. And for our sakes, it would be a new normal. It's not back to the old, it's really a new normal. So collecting the data is important. Data is contained or housed in many different systems. And typically for COVID, we're learning the data is at the state and the local levels. It's found also in academic universities who are also supporting these efforts. And a combination of these types of data sources are necessary to effectively analyze, monitor, and report accurate information. So collecting that information is key. We do know that the type of data that is collected is important. In light of COVID-19, there are a number of different data sources. There are death records, there is information about hospitalization, a lot of information about outpatient visits, lab testing, demographic data about those who are contracting or those who are dying and those who are surviving, and clinical data. And so this information is helpful to be collected so that it can be used to better understand the virus, right? Its severity, as well as social disruptions that are associated with its impact. So collecting the data is important. That's key. Another important aspect of the data analysis and the process is that we apply the appropriate statistical modeling techniques, that we bring that to bear on the information that we are collecting. And so to that extent, statistical modeling is used to often describe and predict. Describe by way of identifying what the current status of something is, right? Predict by way of identifying what can happen. And so there are different types of models, statistical models that can be used. And I think it's important to note that a statistical model is really just something that describes a system that's designed to help the observer understand how it works, right? So we model so that we can understand what's happening, how this virus is impacting us. And so initially, you may have some descriptive statistics. And those types of empirical models are developed in order to really determine the current status. We usually like to do descriptive statistics to identify an immediate observation, right? To look at the data and determine exactly what it is that we are seeing, to see if there are any gaps, anything that's missing, and to be able to collect and aggregate things together so that we get a picture, an initial picture. Other types of models are mechanistic models. Mechanistic models usually assume that there is a complex system that can be understood by examining the workings of the individual parts and the manner in which they're combined. And that's where you get some of the predictive modeling. For our current situation with the pandemic, we're seeing a lot of information about what we mention as flattening the curve.
Right.
And so I think it's important for us to really understand what that term means. So if we would just envision a graph, and envision a graph that shows a tall, narrow curve and a short, wide curve. Both of those curves contain the same number of, let's say, COVID cases over time. If we draw a line across the middle of the tall, narrow curve and the short, wide curve, this line would represent the number of people the healthcare system could handle before it becomes overwhelmed and thereby unable to treat the sick effectively. So the lower curve would create, in essence, a better opportunity to treat everyone. In short, the tall curve means the virus is spreading fast.
Right.
It indicates what would happen if there were no protective measures taken to reduce or eliminate COVID. And so protective measures are things like social distancing, right? And face coverings, those things. The low curve means the virus would be spreading slower, fewer people diagnosed in a given day. Flattening the curve really just refers to keeping the curve low enough, that is lessening the rate at which the new cases occur to prevent like an overwhelming overtaxing of the resources that are available to treat the virus. And so really the focus is on deploying data analysis to give us a real picture, an accurate picture of what that information looks like, whether it's in real time with or without preventive measures.
Awesome. Thank you so much, Natasha. That was almost like data analysis 101. But it's interesting, you noted 3 points. One is about, obviously, what does it mean when we say flatten the curve? So that was very informative for me, especially. And the second thing you touched upon, obviously, was about fake news. So obviously, there are conspiracy theories we hear about. There is misinformation about even how some of the medication that you can take, whereas the
Yes.
vaccine is still in works. So there seems to be a lot of these challenges around data analysis. And the third and most important point you highlighted was all these data sources, right? So if somebody is looking at a Johns Hopkins dashboard, what we don't realize is that they are collating data from 190 countries, making sure the data is accurate so that they portray accurate picture, and using some of the statistical modeling techniques you just mentioned, whether it's
Yes.
empirical or others. So that was really helpful. So my next question is focused more around what are some of the challenges. I know we covered a little bit, but specifically with respect to doing the data analysis before
Yes.
we can say for sure, okay, this is flat, this region or this county or the city, the curve is flattening. I'm sure there are a lot of challenges before we can get to that point. So can you describe a little bit about what are some of the challenges during data analysis process?
Absolutely. You know, it's very interesting. That's a really good question. One of the biggest challenges I think that prevails as we address this pandemic is really the latency of the data. And so when we think about the curve and we think about the frequency that we get the information, that may be the biggest issue. We see from the CDC's website every day that they update every day based on what they have, but there's always a disclaimer. And the disclaimer is that, you know, all of the information isn't in. So when we look, for example, at death records, there are challenges between when the death occurs, when the information is provided. It could be 1 to 2 weeks lag time.
Right.
And so that can skew, and it can create a picture that might be not accurate, not as accurate as if you had the data near real time. So data latency or lag in getting and obtaining the data. The data elements, right? So what is actually contained in the information that you get is also impactful. I know that we've heard in many times during this entire process, you know, what's the demographic look like?
Right.
You know, who's being affected? You know, we saw a lot of information about, you know, underrepresented populations, or the African American community is quite highly impacted by COVID, and, you know, these communities are not. And, you know, so the demographics, where you live, major cities that are hotspots. I mean, when we look at New York and we look at the DC metro area and certain pockets, you know, in New Jersey and California, concentrated areas of people that are just really over top of one another. You know, there are challenges in really getting to the heart of what the demographic truly looks like. We've seen a lot of good information, and I think the challenges are those things that lead us to kind of ask questions about how do we overcome them. And so demographics, incomplete data. In our industry, we're seeing from the work that we actually do with statistical analysis and healthcare insurance programs, you know, we find that we are leveraging claims data, but there are also policies that are impacted. And so some of the challenges are how to really understand the policy and the implication as we grab the data. What is the policy? And what happens if there are some standards of policies that have been relaxed? The implication of that on the data itself can have a widespread impact.
Awesome. Thank you so much. So in that context, Natasha, I know we didn't go over this, but can you briefly describe the services of Integrity Management Services, Inc.? Because as our organization, we have a lot of experts who are even PhDs who deal with data analysis. So I think the brief overview of the organization is pertinent in this context.
Absolutely. Located in Alexandria, Virginia, we brand ourselves Integrity M. We are a women-owned small business, and our mission is really to empower our clients to make informed decisions improving the way they do business. We provide professional and consulting services to government programs in the areas of statistical analysis and modeling, auditing and investigations, also medical review, outreach and education. We provide staffing services as well as technology solution support. And more specifically, in light of our webinar today, with regard to the statistical analysis piece, we perform extensive statistical analysis and modeling to identify potential aberrancies within government health insurance programs. Our goal is to detect and prevent fraud, waste, and abuse in the healthcare programs. And so we leverage data every day to identify where there may be outliers that raise flags, whether it's an individual provider, a nest of providers, and we try to mitigate the risks associated with fraud in these insurance programs. I think of note also is just our technical ability to apply predictive modeling, different types of modeling techniques to bear, especially Swati, as you talk about with artificial intelligence. We're seeing the rise of machine learning, models that are coming forth now to really bear on the industry to prevent the aberrancy before it begins.
Very good. Yes. And I think that is why you are such an amazing guest to have with us today, because those are some of the use cases that obviously we are talking about even in the news, whether everybody understands the implications and the challenges around data analysis or not. So in the interest of time, I'm going to open the floor for questions for Natasha. While we have her here, please feel free to ask any questions with regards to the modeling or flattening of the curve or anything else that integrity management services capabilities are, like she mentioned. So any questions, audience, please? Feel free to unmute your phones, or even you can type in the chat window.
Hi, Natasha, it's Ujwala. I have a question. So as more and more states are looking to reopen, how do we take into, account what's happening across the world and be able to present that data and make some analysis based on let's say, a city that's just like New York or Washington, D.C. as an example, and what are some of the variables that you have to keep in mind as you work on that?
That's a great question. I think what's key, and that kind of takes us to some of the best practices, right? We see the last pandemic that was actually worldwide was the flu in 1918. So we have now experienced in our lifetimes an incredible, change and shift. We can anticipate that will continue. There won't be simply just a local national epidemic. There'll be pandemics because we travel and we have the ability to transmit through our travels. I think that one of the most important things to take note of are the scientists, the public health experts internationally who take actions to develop the types of reports that are necessary to offer guidance on how to lessen and potentially, eradicate the pandemic. In many cases, it can't be completely eliminated, right? But for example, there was an actual report back in March 16th, report number 9 that was sent over to the White House. And it really was about the need to take precautions like social distancing to mitigate the spread and to at least put some types of controls in place. So I think really understanding and getting access to international data will help to inform, really taking a look at and leaning on the experts. This is a public health issue and concern. The public health experts should weigh in. They are experienced in this area to understand how to appropriately communicate that information to the community. I think forums are very important to be able to take lessons learned from what we've seen in other places, especially where there are high concentrations of individuals, and determine how we can deploy. If there are similarities, right, we can do a comparison, some type of analysis of that sort to predict whether the implication will be the same for us. I know we saw that in our country, that as other countries were seeing a rise and then a leveling, that the shift came right across to us, and we're expecting next week is going to be a peak. So I think that we can take our lessons by observing and getting data that is beyond just our national presence.
Thank you.
Thank you so much, Ujwala and Natasha. Any other questions? Please come off mute if you have any other questions, or you can type in the chat window. I see a chat here. Kimberly Hornick asks, what role do you see data analytics playing in helping private industry opening safely?
Excellent question. So one of the things that I noted earlier was that the data analysis that's being done now, the statistical modeling that's used to predict whether or not there's going to be another rise or surgence. We right now, we are trying to flatten the curve, right? But clearly we know that there's a time frame that we must evaluate the outcome. The data, we still need the data. We still need to be looking at the data daily to continue to predict what's going to happen later on. And so I think that there's a huge impact, Kim, to this. We need to be able to continue to do the analyses and to report the trends of what we see so that we understand the implications for reopening, whether it's the local gym, or whether it's the school system. The data will really inform us of what could potentially happen.
Thank you. And it's funny you mentioned that, because one of the things I was thinking is, suppose your data is little bit skewed. So instead of looking at couple of weeks, if you look at couple of months, your curve is going to be totally different. Think about if your x-axis is time over 1 year, maybe it's totally flat. So it's so important why this data should be in the right format, and the data analysis should be done in the correct manner. So that visual just came to my mind. So thank you again. And I think we are out of time, just 2 minutes over. So Natasha, thank you so much. This was really valuable. It helped me learn a little bit more about data analysis in the context of COVID-19. And to everybody who participated today, thank you. We would love to hear back from you about the feedback. Please leave your comments in the meetup group. Also coming up is a series of webinars on cultural AI. Do check them out and attend if possible. Thank you, everybody. Stay safe and have a good day. Bye-bye.
Thank you. Goodbye.
Bye.